Hi, this is our individual therapy session, and for this part, I'm playing the therapist, Nicole is playing the client, and she has a phobia of spiders. So we're going to discuss that right now. Hi, Nicole.
Hi.
It's nice to meet you.
You too.
I'm glad you decided to come in today. So I'm just going to brief you in that everything we say here is strictly confidential, so feel free to share anything that comes to mind. And so what brings you here today?
I have a fear of spiders, and when I see spiders, I just get very scared, and my heart starts racing. And like, instead of trying to kill them, I avoid them, and I just think it's becoming a problem.
Right, so what I'm sensing is that you're terrified of spiders, and it's just becoming a problem. But can you elaborate more on why it's becoming a problem?
When I see a spider, I concentrate more on how to kill the spider on how to kill the spider without coming in contact with it.
So what I'm getting is that you rather kill a spider without being in close contact with it.
Yes.
Okay. So why don't we try this?
Okay.
We're going to try a little exercise. So if you don't mind closing your eyes, please. So picture your quiet place.
Okay.
So can you give me a sense of what you're picturing?
I'm on the beach, and I'm just listening to the waves.
Okay, that sounds very nice. Well, let's say that a foot away from you see a spider. Is a spider.
Mm-hmm.
So from society level, 10 being the worst, 1 being the not so. What is your anxiety level right now?
It's about a 6 right now.
Okay. Well, let's say the spider now is getting closer, is crawling closer to your beach towel, but has not touched you yet. Where is your anxiety level at this moment?
It's about a 7.
Okay. Now, you get even more. The spider's going to get even more and more close contact with you. It's like brushing on your arms.
Mm-hmm.
Where is your anxiety level now?
It's a 9 now.
Okay, you can open your eyes now. That is pretty high.
Mm-hmm.
So your anxiety level gradually increases as the spider gets closest.
Yes.
But what I noticed
Mm-hmm.
is that when a spider is like maybe a foot away, your anxiety level is still kind of high.
Mm-hmm.
Not up to like a 10, but still pretty high. So while you were in your quiet place and you saw a spider, do you mind telling me what came across your mind?
It was just like an instant fear, and I got very scared, and my heart started to race, and it was just, I was no longer relaxed. I was uncomfortable in the situation.
Okay. So your fear of spiders, that's becoming a serious problem in your life. We tried to do the exercise, and I got a sense of what you were feeling. What you feel when a spider is close near you. So what we're going to do in the next couple of sessions, we're going to try exposure therapy. And it is basically, we're going to expose you to the spiders, but not to the real spider, of course. We're going to start smaller.
Mm-hmm.
So I would like you to go home. And look up pictures on the internet of spiders. Maybe like 3 or 4 maximum. And write down what exactly you're feeling. You can also do the anxiety level, the scale.
Mm-hmm.
And write down what exactly you are feeling, and we will discuss it more in the next session.
Okay.
But it was really great to see you.
It's good to see you.
I'm looking forward to meeting you again.
Me too.
Have a good day.
You too. Hi, in this part, I'm the therapist and Marie is the client, and this is our first session, and she has come in today because she is very shy. Hi, Maria. It's nice to meet you.
Nice to meet you too.
I'm glad you decided to come in today, and I just wanted to tell you that anything you say in this room is completely confidential, so feel free to say anything that comes to mind. And why don't we start by you explaining why you're here?
Okay, I'm here because I'm very shy. And it's becoming a real problem in my life, like, very much.
Okay, well, I can understand how that could be a problem, and would you like to elaborate how that is a problem for you?
Okay, well, I just moved here, so, well, I left home actually, and became George Mason, and I'm a junior, and I'm not very good at making friends, because when I first meet someone, I kind of, like, think in my head, oh, they're not gonna like me, they're gonna judge me and stuff like that, which maybe they might not, maybe they will, but I just, like, the only person that I hang out here on campus most is my roommate and a couple of friends, and that took a long time for me to, like, actually, like, get to know my roommate more and stuff, even my friends, and it's, like, I can't, like, talk to new people, like, it terrifies me sometimes, and it's, like, and it's becoming a problem because, like, I want to go to, like, a party and stuff, but, like, I know that I won't socialize with anyone unless I know them. And, like, I wish I could just be, like, so outgoing, like, there are a bunch of people that are, but, like, I can't. It, like, terrifies me a lot.
So I get the impression that you are very worried about how you're going to make an impression on people, and you would much rather be with, like, a small group of friends than, like, a large party or something like that. And it's something that you want to change, but it's difficult for you to do.
It's very difficult.
Okay. Can you explain how it feels when you have to socialize with people?
Well, my mind starts racing because, like, I have all these thoughts, like, how should I approach them? What do I say to them? Will they like me? Will they judge me? And it gets very overwhelming at times, and, like, and if I do try to approach someone, I get, like, so red, I, like, sweat a little, and my hands get all clammy, and I don't know, I just don't like attention in a way. I just want to, like, I mean, it's easy, kind of, in a way, if I know the person, but if I just met them, then I can't. Like, it's even hard for me when you're in class, when I'm in class, and, like, the teacher calls on you, or, like, I have a group member that, like, wants me to put feedback into, like, what we're talking about. I just can't, because I don't want to look dumb and stuff like that, and it's very hard for me.
So I get the impression that that you don't like being the center of attention, like you don't like to be put on the spot.
No.
Okay.
That terrifies me completely, like, yeah.
Okay. How would you have you tried have you ever tried, like, any, like, have you, like, have you ever tried anything that maybe to, like, help you to be more social, maybe?
I mean, I've tried and gone, like, to hang out with some of my friends, and they have, like, other friends that they introduce me to, and, like, at first they'd be like, oh yeah, hi, how are you, you know, like, small talk, but then after that it, like, gets too much, and I'm like, I don't know what to say, like, what do I say, like, what is this person thinking right now? I don't know, it's way too much.
Okay, so in this session, we talked about how your shyness is becoming a problem and how you're afraid of the first impression that you make on people, and you would much rather be in a small group of people than a larger group of people. So we are almost out of time, actually. So I'm going to give you some homework so that we can hopefully see some improvement next time. So in the next week, I would like you to try and talk to at least one person in one of your classes, and and then maybe afterward, kind of write down how that made you feel, and maybe you could even try some breathing techniques to see like if that helps you at all. So it was nice to meet you, and
Nice to meet you.
I'll see you next week.